What challenges do immigrant parents face with American health care? Imagine moving to a new country and trying to understand a healthcare system that feels completely different from what you know. That's what many immigrant parents, especially those from Asian American families, experience every day. Navigating healthcare in America can be full of surprises and obstacles. One big challenge is money. Many immigrant parents struggle to afford healthcare because they don't have insurance or their coverage doesn't cover everything. Even families with higher incomes or education often find healthcare costs too high because of large family expenses. This can cause them to delay or skip needed medical visits for themselves or their children. Another issue is immigration status. Some families can't access programs like Medicaid until they have been in the country for at least 5 years. Others are afraid to sign up for health services because they worry about how it might affect their immigration papers. Rules like the public charge will make families hesitant to use available health programs, even if their children are U.S. citizens. Language barriers also create big problems. Many parents don't speak English well, making it hard to understand doctors or fill out paperwork. They might feel anxious about explaining their symptoms or asking questions. This can lead to avoiding doctor visits or relying on unreliable sources for health advice. Printed materials and online health resources are often not available in their native languages, making it even harder to get clear information. Cultural beliefs influence how families approach health care too. Some parents prefer traditional medicine or home remedies over Western medicine. They might delay seeing a doctor because they believe in natural cures or have concerns about Western treatments. Health literacy, or understanding health information, is often lower among immigrant Asian American parents. This makes it tough to manage their children's health or understand medical instructions. Acculturation stress adds to these challenges. Moving to a new country and trying to fit in can be overwhelming. Parents often feel torn between their own culture and American ways. When they have to care for aging parents or handle their children's health needs, it can become too much to handle. This stress can make it harder to focus on preventive care or regular checkups. Systemic issues also play a role. Lack of transportation, busy work schedules, and not enough healthcare providers who speak their language or understand their culture can make accessing care difficult. Some families experience discrimination or unfair treatment in healthcare settings, which discourages them from seeking help. To help Asian American immigrant parents, it's good to find healthcare providers who speak their language or are culturally sensitive. Community health centers can assist with insurance enrollment and health education. Families should talk openly about health needs and push for preventive care despite barriers. Learning about public health programs and legal protections can reduce fears related to immigration status. Using translated materials and trusted community resources can improve health literacy and help families navigate the system better. Understanding these challenges helps immigrant parents find ways to overcome barriers and keep their families healthy. It's about making sure they get the care they need while managing the stress of adapting to a new healthcare environment.